about a very controversial topic, and you're going to get both sides of the coin, all right? As we discuss this evening, I want you to hold your questions, because I'm going to go through some information first, and I'm going to give you some examples of what we've seen in our office clinically, yes, and also discuss with you some of the options that we have for treatments and ways to actually improve immune function. So our topic this evening is immunizations. And as we begin, let's just talk first of all, what is the immune system? And Ben, he is fine. You don't need to leave. You don't need to think that he's making too much. That's why we're here. All right. Okay? You stay right here, Dad.
I have to say this refreshing to see a dad to be the one.
Isn't it?
Instead of doing that.
I know.
All right.
It is pretty good. So kudos to you already tonight. All right. Way to go. Let's talk about the immune system, and let's talk about the way that the immune system works in the body. When we look at immunity, immunity really is the body's ability to fight off infections. When we have a confused immunity, we have what we call autoimmunity. And when we have an immune system that works correctly, we have something called active immunity. But for our newborn baby, we have something called passive immunity. Passive is what we get from something called colostrum. And this is the big push then for nursing and feeding babies. We saw that Utah has this new emphasis on breastfeeding babies. Imagine that. God actually created milk for babies through the mom to take care of the baby. We should get back to that. Great idea. So, passive immunity is the way by which the baby who has no immune system when he is born. Okay? When she's born, she has no immune system of her own. It's dependent upon mom to give immunity through antibodies called immunoglobulin A, IgA. Remember when we were kids, there was IgA, was a grocery store, it was working for you? Okay, that's how I remember that, because through mother's milk, we actually have IgA, immunoglobulin A, passively passed on to baby. Now here's the interesting thing. IgA is also the immunity of the GI system. So if mom has a healthy GI system, her IgA is healthy. But if mom has multiple food sensitivities and her IgA is out of whack, and now she's actually giving lots of IgA to baby, and she's inflamed, and her intestines are inflamed because she has a gluten intolerance or a dairy intolerance or a shellfish intolerance, she goes out to eat, comes home and is feeding baby, and all of a sudden baby's projectile vomiting. Or mom eats ice cream every night to calm her stomach because that's just a reward for the day for being such a super mom. And now baby is projectile vomiting. We have to take a look more closely and say, okay, what is it that I could actually be passing on? Is my passive immunity, mom, healthy or unhealthy? Is it building baby or is it actually destroying baby? Is it helping baby's brain to function or is it creating more inflammation for baby's brain? Okay, does that kind of create a question? An interesting question. Let me actually read a quote from Dr. Karazian's book, Why Do I Still Have Thyroid Symptoms When My Blood Labs Are Normal? He says, autism starts with the mom. I'll no longer address a woman's infertility until she has first restored the integrity and function and health of her immune system. I am finding an autoimmune disorder is often the root of autism, with the immune system attacking brain or nerve tissue of the child with autism. Children born with an immune system that is a ticking time bomb are vulnerable to anything that can launch a self-attack, whether it be a vaccine, food intolerance, blood sugar imbalance, or heavy metal toxicity. When a woman goes into a pregnancy with a leaky gut, dysglycemia, multiple food intolerances, and adrenal fatigue, and we'll add there polycystic ovarian syndrome, which is testosterone elevation and insulin resistance, I believe she is putting her baby at risk for developing one of the increasingly common modern health disorders, including autism spectrum disorders, eczema, asthma, food allergies, and food intolerances. Okay? We'll come back to that in just a bit. His next statement that I want to just read has to do with literally adrenal fatigue and adrenal function during pregnancy. Did you know that a pregnant mother can pass on adrenal dysfunction to her unborn child? Studies show that in her 3rd trimester of pregnancy, a woman with adrenal exhaustion. So what does adrenal exhaustion look like? Fatigue, okay, AM fatigue, after I eat meals fatigue, difficulty falling asleep, difficulty staying asleep, my cravings for sugar, my cravings for salt. Studies show that in her 3rd trimester of a pregnancy, a woman with adrenal exhaustion will draw adrenal hormones from the baby through the umbilical cord. As a result, the child is at risk for being born with compromised adrenal function. Since adrenal dysfunction so greatly impacts immune and gut health, and since it is nearly universal these days, this helps explain the increasing rates of allergies, food intolerances, eczema, and autism among children, not to mention maternal postpartum depression. Okay? So those are just a couple of things that we want to really think about now as we kind of launch into a concept of immunizations and health. First of all, how healthy is mom when we look at immunizing a child? How healthy was your pregnancy? How healthy were you going into the pregnancy? How healthy were your adrenals? Do I have postpartum depression when I'm actually presenting this baby to actually have immunizations done? Okay? Because my health is a window into baby's compromised health if I have poor health. GI health then. With the GI system, the healthier the GI system then, the better we see the IgA markers. IgA is just one of those passive immunities. Active immunity, when it's acute, we look at something called IgM. So these are immunoglobulins again. And then as it goes on to chronic or long-term immunity, we actually use IgG. Okay? There are 2 other immunoglobulins. D and E are also in the body. IgE is the histamine releasing with type 1 immune hypersensitivities, and D has to do with programmed cell death. This is the immunoglobulin that actually attacks cancers or aberrant cells in our body, and the healthier it is, it actually kind of winds down, and the cell will actually produce a neurochemical that attracts these immunoglobulins and says, signal me, I'm getting weak, I'm ready to go. Okay, so let me go. And that's exactly what we see with the IgDs. So this type of immunity is what we call humoral or plasma-mediated immunoglobulin antibody antigen response. We'll just use antibody antigen reactivity. Okay? Antigens are antibody generating. So a flu virus that's presented to the body, an antibody then is what's formed as a memory long term. So when you had chickenpox as a child, you would have IgG that could be measured and say, oh look, I had chickenpox. If you had mono or Epstein-Barr virus, if you've had then potentially a vaccination, they measure that. If you have a long-term humoral antibody response or plasma or antibody response in the body, they actually can measure your IgG exposure. Okay? When we look at the body though, it also has, so this is also what we call type 2. We also have a type 1 immune response, and that has to do with what we call natural killer cells. Okay? Natural killer cells are the first scavengers when we're exposed to something that chew things up. These are the macrophages. They look for an infection, they chew it up quickly, and then absorb it. And then they present it as an antigen to the other cells to produce antibodies. So when a person receives a vaccination, the vaccine is a broken down portion of the virus or broken down cell so that it actually is exposed to the body, and now when the body recognizes that protein again, it says, oh, there's that bad guy, I better attack him. So there's already a trigger where that antigen then becomes the activation for that. Okay? So we have these 2 types, type 1 here, Th1, and type 2, Th2. immune responses in the system. So let's back up then and talk more specifically about immunity and immunizations. And if you have a question about any of these, just write it down and we'll talk about it in just a moment when we get through the majority of the information. When a child receives its first vaccination, the first one offered to the child is what at birth? Hep B. Okay? Let's just talk a little bit about hepatitis. Hepatitis refers to inflammation of the liver. Hepatitis is a specific viral complement, though, of A, B, C, D. They actually go E, F, and G now. There are multiples. Hepatitis A is the one that is passed by fecal oral, so poor hand washing. Okay, this is the one that we always say, be careful if you go to a restaurant where you're uncertain of the food handler, or if you're using food off the street in essence. Okay, you're eating at an open air market, the likelihood of you picking up hepatitis A is very high. Hepatitis B can only be transmitted by two means. Okay, blood, so intravenous drug use, or by sexual contact, right? So how many of your newborns, honestly, are going to be involved in either of these activities? 0, right? Not my child. And not only that, when a baby is born, how much immune system does it have of its own? 0. It's dependent upon mom's passive immunity. So we're actually giving an injection at baby's birth to ask if the system can respond, and it has no ability to even respond. So if your child comes out blue and its APGAR score is down around 4, how smart should we be in responsibly giving this vaccination? Just a question, all right? I'm just posing it to you. And as parents, if this is the only means by which this can come to them, and you as a parent have been a responsible young adult or mature adult, and you're not a carrier of this, what are the likelihood of this baby receiving this? About 0. Okay? So again, just a question. Next vaccinations come shortly thereafter. Okay? And each of those then have basically a portion of the virus, so either the viral capsid, the viral DNA, and is a virus alive or is it non-living? It's non-living, okay? It actually has no ability to pass on its gene code. It is completely dependent, a virus, on landing on a healthy cell, injecting its genome into the cell, and incorporating the body's own or the cell's own organelles to replicate that virus, produce more of it then, and be able then to open up and actually, or lyse it's called, and actually then explode and put that out into the system. Okay? So by taking a portion of this, or just this portion of the virus as non-living of that protein, and mixing it up and putting it into a vaccine, we can actually then introduce it into the immune system and ask the immune system now to respond. Okay? That's the theory behind a vaccination. If that works correctly, then the body, through that type 2 humoral antibody antigen response, will actually produce an antibody then against the infection and then be prepared if it's exposed. Okay? So in some of our lives, some of us have seen the value of polio vaccinations. Okay? Some of us now more recently have seen the implementation of a chickenpox vaccination. How many of you can remember the last time you've seen chickenpox now in your community? When's the last time that the kids in the nursery school or preschool or the grade school have had chickenpox? Yeah.
It's a baby.
Yeah. So some of you then remember when you had chickenpox. Remember when your siblings had the chicken pox and it went through the house? And yet, how many of you now have seen the secondary infection of chicken pox called shingles? And how many of you have actually seen shingles now in young people? Remember when shingles was the old person disease? Do you remember when, oh yeah, grandpa had shingles? Or yeah, the neighbor had shingles and it was so bad. And now, how many of you have actually seen children with shingles? Raise your hand if you've seen a child with shingles. Okay? It is miserable. It used to be the old person's disease. Now we don't see children with shingles. We see that chickenpox virus not exposing and coming out as full-blown chickenpox. Remember the scars that you get when you scratch those little vesicles? Now we see children with shingles. Okay? So what have we done? Have we really eradicated it? Have we suppressed it? Or have we just quietly infected it and now it's in the body and it's expressing when it should have been just chickenpox? Now it's coming out as this recurrent neurological disease called shingles. Right? Again, just a question. I've seen now multiple children with shingles in their armpits, shingles in their back and along their spine. I've seen adults with chronic shingles, especially in the sciatic distribution in the low back and into the groin. Talk about painful. Okay? So again, have we made the body better or have we actually created a premature